for a behavioral health respite update.
Thank you, Jennifer. Good afternoon. My name is Tina Burrell, and I'm an acting supervisor with the prenatal through 25 behavioral health section in the Division of Behavioral Health and Recovery at HCA. And today I'm providing an update on efforts to implement behavioral health respite care for youth and young adults. First, I want to provide some background information. I want to share the current definition of respite care services in behavioral health, and that is the observation, direct support, and monitoring to meet the physical, emotional, social, and mental health needs of an individual by someone other than their primary caregivers. Respite care should be provided in a manner that offers necessary relief to the caregivers, and respite may be provided on a planned or an emergent basis and may be provided in a variety of settings. I do also want to highlight that behavioral health respite is not a Medicaid service. However, it is allowable with other funding, local or federal. Also would like to provide an example of what is respite. We have an example that's been funded through federal dollars under the System of Care grant. And under that, they have offered overnight respite services, day respite services, an after-school respite program, and family supported with peer coaching while also receiving respite services. So that's a bit of the background, and on the slide, you'll see what's happening right now. We were directed by Proviso 82 that Healthcare Authority would contract with Mercer Health and Benefits to evaluate options for a Medicaid waiver, so it could be funded under Medicaid, to provide respite care for youth experiencing behavioral health challenges. And with that, we have options in the technical report that provide some context for Healthcare Authority to evaluate potential avenues for establishing this benefit. The options also identified in the Mercer report take into consideration existing respite benefits provided by Developmental Disabilities Administration and the Department of Children, Youth, and Family. We certainly do not want to cause any adverse impact to already existing and much needed respite services. The technical report by Mercer was completed on June 30th. You are welcome to review that report. It is posted on our website. There's the information and link there. We've also created a companion document, a one-pager, that shares some of the history about this effort and this initiative. We'd like to honor that the request for respite across the state was first brought to our attention through Family, Youth, and System Partner Roundtables, FISPERTs, highlighting the need for youth and caregivers and families to have access to respite. And this information then moved forward and elevated to the Children and Youth Behavioral Health Work Group, who took it upon themselves to identify it as a recommendation. And now we have Proviso 82, which we've completed that. It's also my understanding that the Children and Youth Behavioral Health Work Group are continuing with a recommendation for HCA to follow up on these options and also support the pilots that we've seen under the Systems of Care grants or similar pilots and work. So we are grateful to that historic work and want to honor them for bringing that forward. And our job now at HCA is next steps, what's happening now. And we are reviewing those options in the technical report and having conversations about what we could move forward. So as you've heard from other presentations and from Diana's opening, we are providing these updates frequently. And so in the coming months, you will learn in real time kind of how we want to move this forward and what options would fit for Washington State. So thank you for your time and any questions, feel free to put them in the chat. Appreciate